Good morning, everybody. We'll start in 1 second. Carolyn, are you anybody else on this panel?
We have Marissa Altavilla also joining the panel, but we can go ahead and get started and she can join us as she's able.
Okay, excellent. So good morning, everyone. Thank you for joining us for this session. My name is Jennifer Grossman, and I'm the Coordinator of Research and Evaluation for the Higher Education Policy Commission. I'm pleased to introduce our session, Mental Health on Campus, Student Advocates Speak. Before we get started, I'd like for you to feel free to add your questions throughout the presentation in the session chat box that's right to the right of your screen. I see that some of you have already found it. We'll address any questions that come in at the end of this presentation. And with that, I'd like to introduce Ms. Carolyn Canini. Carolyn joined the Higher Education Policy Commission in 2019 as the Director of Behavioral Health Programs. She promotes educational initiatives to increase the state's behavioral health workforce and supports the state's colleges and universities in addressing student mental health. Carolyn came to the Higher Education Policy Commission with experience in directing statewide programming for a national nonprofit, as well as experience in providing support, resources, and disease education to healthcare professionals and community members across West Virginia. Before returning to her home state of West Virginia in 2013, she spent several years working with youth and families in rural community in the mountains of Northeast Arizona. Carolyn received her master's in social work from The Ohio State University, where she works on research evaluating the state child welfare decision-making model and the impact of access to services for seniors in public housing. And now I turn it over to Carolyn and to the panel.
Thank you so much, Jennifer. Good morning, everybody, and welcome to the breakout session, Mental Health on Campus, Student Advocates Speak. We're really happy that you've joined us today, and we're excited to hear from our panelists about the mental health awareness efforts led by students taking action to reduce stigma, create supportive communities, and save lives on their campuses. As Jen said, I'm Carolyn Canini, and I'm a social worker and work with the Higher Education Policy Commission, where I have the pleasure of being able to work with individuals on college campuses across the state who are really doing the work to help address mental health and wellness of students on their campuses. So in preparation for the panel today, I had the opportunity to interview many students who are engaged in mental health initiatives on their campuses, including today's amazing panelists who are really truly each making a difference in fighting stigma that keeps people from being able to seek services for their mental health. So during our time together today, I'm first going to introduce our panelists and tell you a little bit about them and lay a little bit of groundwork for our session. And then I'm going to invite each panelist to give an overview of the work that they're leading on their campus. And then we'll spend the rest of the time together discussing questions that relate to student-led mental health awareness and advocacy work on campuses. So as Jennifer mentioned, if you have a question for the panel, please feel free to submit it through the chat at any time, and we'll get to it further on in the session. So I believe we have one more panelist that's going to be joining us. And so Jennifer, if you can just be on the lookout for Marissa. When she joins us, you can just add her right in. There she is. We just spoke it into existence. Marissa, thanks for joining us. So we're just getting started today, and I want to go ahead and introduce each of our panelists who are on the call today. First of all, I'd like to introduce Amy Gatto. Amy is joining us as the Senior Campus Program Manager for Active Minds, which is the nation's premier nonprofit promoting mental health for young adults. Amy is interested in the relationship between health and education, and blending together her experience as a former high school teacher, higher education health educator, and young adult health researcher. She has really found her niche in working to improve adolescent and young adult mental health. She's a doctoral candidate at the University of South Florida in the College of Public Health, and she holds a master's degree in public health from University of North Carolina at Chapel Hill and a bachelor's of arts in human services from Elon University. And we'll hear from Amy in just a minute, but if you just want to give us a wave, Amy. Thanks for being here. We're also honored to have Marissa Altavilla. She's a junior at Fairmont State University, and she's majoring in information systems management and minoring in data analytics. Marissa is a member of the Active Minds chapter at Fairmont State and is a student assistant and peer mentor at the Learning, Enrichment, and Academic Development Center, or the LEAD Center, which started as a tutoring center, and during her time there has expanded into a resource with a wide range of student support services. Marissa is also a member of Falcons with Pride, a support group for LGBTQ plus students and allies, which also promotes mental health, coping strategies, and an overall safe space for everyone. In addition to these roles, Marissa has interests in some related campus efforts, such as support for domestic violence and sexual assault survivors, and overall support for students through the stresses of life. So welcome, Marissa. Thank you for being here today. We're also very happy to be joined by our third panelist, Soen Daniel. Soen is a junior at West Virginia University, majoring in sport and exercise psychology. He has been active in the Student Government Association at WVU, and just this past semester, he wrote a resolution to include a mental health statement on course syllabi for all of the academic courses across several different departments at WVU. Soen has also been instrumental in the launch of the new Student Mental Health and Wellness Advisory Board in collaboration with WVU's Counseling Center. With 28,000 students at WVU, Soen's work to raise mental health awareness has really focused on gaining administrative support for student-led efforts. So welcome, Soen. Thank you so much for being with us. All right, and as we get started today, I wanted to also acknowledge a couple of students who assisted in the preparation for the panel, but were unable to join us live today. First of all, we have Katie Kahn. She's a fourth-year medical student at Marshall and has been active in raising mental health awareness at the medical school and is passionate about building a culture in medicine where mental health is health and where providers and students can talk openly about mental health. Katie has worked on many student-led mental health initiatives, including adding substance use screenings to the services provided by the student-run clinic in Huntington. So we appreciate Katie's contributions. Today's panel was also informed by Caitlin Stump, a senior elementary education major active in Fairmont State's club, The Hidden Opponent. Caitlin serves as a co-captain for this group, whose goal is to reduce the stigma that surrounds mental health, specifically in student athletes, and to provide them with the resources they need when struggling with mental health. Finally, Lily McKnight, a master's student in human resources management at WVU, also helped support the planning of the panel. Lily has been active in WVU's Student Government Association and was the one responsible for writing a piece of SGA legislation to start the Mental Health Advisory Board, which we're going to hear more about from Soen shortly. So when we look at mental health on college campuses over the last year and a half, there is so much to talk about. We know that according to this survey from March, 65% of students rated their mental health as fair or poor, and over 50% reported feeling anxious, worried, or scared about their life within the past 6 months, either often or constantly. Of course, on top of all of that, we also know that college students, because of their participation in the service industry, were particularly hit hard by job losses and other economic stresses related to the pandemic, in addition to the many other stressors impacting their lives. And so we also know that according to a recent survey, when students were asked who they relied on for emotional support during COVID, the most common response that they gave was their friends. This finding is not just during the pandemic. This is consistent with other pre-COVID surveys asking students who they turn to for emotional support and help with their mental health. And to me, findings like these really underscore the importance of the work that students like our panelists are doing to help each other care for their mental health and the importance of these student-led mental health awareness efforts on our campuses. Because students are turning to other students first when it comes to their mental health, it's crucial that everyone has a basic understanding of mental health and the tools they need to talk about it with others. And that's exactly what our panelists today are passionate about. Another recent study published in the Journal of the American Academy of Child and Adolescent Psychiatry reported that students who are empowered to talk about mental health are highly effective drivers in shifting the campus climate to be more supportive of mental health. The study found that participation in student peer organization activities can both improve the mental health attitudes and significantly increase helping behaviors among students. In particular, in this study, as students became more involved with the Active Minds chapter on their campuses, they were more likely to reach out to classmates or friends who were struggling with depression or anxiety or suicidal thoughts. They found that among the general student body, even just a basic familiarity of the mental health student organization on campus, which we'll hear more about from Amy shortly, increased knowledge and positive attitudes about mental health, in turn helping to kind of create that more supportive campus climate and potentially increasing the likelihood that students will seek mental health support when they need it. So the panelists that we are about to hear from are going to share about how they each became empowered to talk about mental health and how they've seen student-led efforts they're involved in contribute to fostering a campus culture that encourages conversations about mental health and help seeking. So now it's time for us to hear from each of our panelists. And first of all, I'd like to turn it over to Amy Gatto to share about her work with Active Minds to equip students to be leaders in mental health. Thank you for being here with us today, Amy. Take it away.
Thanks, Carolyn. I'm excited to be here today. So as Carolyn said, my name's Amy Gatto. I'm a senior campus program manager at Active Minds. For those of you unfamiliar with Active Minds works, we're the nation's leading nonprofit organization supporting mental health promotion and education for young adults. We believe in speaking openly about mental health, creating communities of support, and encouraging each other to get help when needed to take action for suicide prevention. Together, we're changing the conversation about mental health. And we do this through a network of 800 campuses, workplaces, schools, and communities, where we use the power of peers to change the conversation about mental health and reach people where they are, whether it's on campus, at home, at work, and in their communities. We started 17 years when our CEO, Allison Melman, lost her brother to suicide. From there, she realized the power of peer-to-peer connection. Many students go to their peers. They're the first people that they talk to, as Carolyn shared from the data. With that, we have worked across colleges and universities to establish these chapters and support students in ways that are student-led and student-driven. Since then, we've expanded to the K through 12 space, offering programming specifically for high school students, but moving into this upstream approach in how can we support students earlier to reduce stigma, to create awareness about mental health resources, and begin to recognize signs and symptoms, ultimately increasing students' mental health literacy. We've also expanded to the at-work space. So we focus on adolescents and young adults, recognizing that once our students graduate, they join the workforce. Most of them join the workforce. And so what can we do to prepare employers to support employees' mental health? Now, some of our signature programs include the Active Minds Speaker Series. We have so many speakers who share the stories about how mental health struggles have affected them and their lives. It can be incredibly powerful to capture this idea of storytelling. We also have an interactive exhibit called Send Silence Packing. It's a visual display recognizing the loss to suicide. During the COVID-19 pandemic, we actually transitioned to include an online piece of that. called Behind the Backpacks, where you can dive deeper into some of those stories, allowing us to reach more people during the pandemic from their home. We provide so many resources and guides to administrators and students on college and university campuses. So we have guides for faculty and staff, we have a COVID resource hub, we have so many guides for students about how to mobilize to support student mental health. And through all of these pieces, we're working together and letting students drive us to change conversations on campus about supporting student and faculty and staff mental health. I'll turn it back over to you, Carolyn.
Thanks, Amy. We're really happy to have you on the panel today and appreciate the work that you're doing on campuses all across the country to help students like these get the tools they need to do their work. So Marissa, you're helping lead other students through both your work and your volunteer roles. So I'm going to turn it over to you to talk to us a little bit about how you got involved with mental health advocacy and how the Lead Center and the campus clubs you're a part of are working together to help students.
Okay, so I'm going to apologize in advance. My dog is going crazy, so I'm going to try to keep him calm while I'm talking. But so basically my freshman year, the spring of, I decided that I couldn't just sit in my classes and do nothing else, that I was going to try to get involved in something other than just school. And when I scrolled through our different clubs and different organizations that we have, I ran into Active Minds, actually. And I decided to do a little bit more research in what that was all about and realized that it was something close to me, mental health, meaning that I couldn't just let slip through my fingers if there was something that I could do about it. So actually, hold on one second. I'm going to try to pick up my dog. Okay, everybody, this is Charlie. So in my family, actually, mental health has been a huge stressor, and it's run down through. My parents actually got divorced when I was 12, and counseling and just talking to people and knowing that there was somebody there for me was pretty much the only thing that got me through life and school and being able to be involved in sports and all of the such. So I decided that if there was somebody going through something similar, especially with Falcons with Pride, I know it's really difficult to be pretending that you're somebody that you're not, or if you are out and you're worried about being seen as who you are, it can be awful and terrifying. And if I could be that person that was there for me, I wanted to be that person for somebody else. And Active Minds really helped me do that. So when I came to the tutoring center at the time, and I was able to speak to people and help them with, just their schoolwork, it felt amazing. And when I got talking with Brittany Kuchta, our supervisor, she had all these ideas for what we could possibly be and helping people with their mental health the same way that Active Minds does. And that's when we all kind of started brainstorming, and she and Amy Snively, our Active Minds leader, kind of got this midday meditation together. And it's been a huge help to a lot of our students, I think. So the effort in itself has been something incredible to be a part of.
Thank you so much, Marissa. And you all can see on the screen some of the work that she has designed to help promote the different events that Active Minds and the Lead Center are teaming up to provide for students, whether that's meditation or just relaxation time to take a break during difficult weeks at school. So she's also using her artistic skills to contribute to the work that she's doing. So thanks again for being here, Marissa.
Thank you.
Next up, we're going to hear from So and Daniel. And as I mentioned before, So and is involved with the Student Government Association. And so let's hear a little bit from you about your involvement with mental health awareness at WVU and how you have been working to help students.
Well, good morning, everyone. Like Carolyn said, my name is Soen Dane. I'm a junior sport and exercise psychology major from Chantilly, Virginia. I've been involved with student government at West Virginia University since the fall of 2019. And then spring of 2020, we all know the pandemic hit. Physical health was just one barrier to it, but a lot of students, their workplace and their home became one. And because of that, we soon experienced a lot of mental health issues. I had a lot of friends who've never struggled from mental health issues struggling for the first time in their life. I had friends who've been struggling all their life, struggling even harder. And I knew that with the position I was in, that I could be able to do something. So for starters, in the fall, what me and a few other people in student government did, we created a mental health syllabus statement alongside our career center, which is our counseling center. The reason for this was so we could promote resources better. A lot of students on campus still don't really know the career center exists, and we kind of just wanted to get the word about that even more. If we could get professors to talk about it first in their classes, chances are students would listen. But I know there was a lot more we can do. So the next thing we did was we created a wellness and mental health advisory board. The reason for this is we wanted direct student input to go to administrators, because usually we see it as two different islands of students and admin, but we wanted students' opinions and thoughts to drive what administrators do directly. And we thought having this group would help create that. So this is their inaugural year. Can't wait for them to kick off.
Thank you so much, Soen. We really appreciate you sharing a little bit about that. And so now that we've heard from each of our panelists, I'm ready to kind of get started with asking some questions. And so I wanted to start with Amy. Marissa and Soen both have talked about the partnership between the student-led clubs and then student support services or other organizations or other campus-based resources. So I know that Active Minds has a framework with several principles for strong student-led mental health initiatives. Amy, can you tell us a little bit more about that work from Active Minds?
Absolutely, Carolyn. So one thing that I really appreciate hearing from Marissa and Soen about is the way that students have been mobilized to create changes on their campus, and the way that administrators were receptive to those changes. So Active Minds has two frameworks that we use for student mobilization. And of course, like most frameworks, they have acronyms. So first, there's SEATS, and this framework is for campus staff, faculty, and administrators. So as administrators, we know that students know students. So my background is administration in higher ed, and in so much of my work there, from an administrative level, it can be easy to fall trapped to just making decisions for what we think is best for students. And this framework, SEATS, was established by some of Active Minds Healthy Campus Award winners. So these are some campuses across the country who've been recognized for their work in promoting student well-being, both the mental health aspects and the physical health aspects. And so working with those campuses, we developed this framework to ensure that efforts to improve student mental health engage students as equal partners in their work. So often we have these task forces or work groups, we have maybe one student representative. But really the way that this framework works is making sure that our students are offered a seat at the table. So ways that this is done is it's student informed. So we're elevating the voices of our students and also using national or local data on about our students to determine what we should be focusing on. The work is equitable. So it addresses gaps in opportunity among populations that are historically marginalized, offers culturally competent services, and engages in partnerships from the very beginning of the process, ensuring equity is woven throughout. It's also actionable. So students are equal partners, like I said. They're not just end users in the work. And students are involved in all stages of the process. So the initial, the planning stages, having focus groups or conversations with students, and then also in the implementation. Students are activated to be part of the work. It's also transparent. So there's nothing worse than being a student and not really knowing what or how is happening. So this process allows for two-way communication with students, whether it's through town hall meetings, focus group, social media campaigns. It also allows for administrators and researchers on campus to share the findings with students. So not only is it implementing programs, it's evaluating their effectiveness and then reporting back to students, the key stakeholder for this. And then the last part of SEATS is that it's sustainable. So the idea is that our mental health work continues over time, that we're putting funding, human time resources into our programming and building systems such as Active Minds chapters on our campuses to ensure that students are staying engaged in the mental health promotion. Now we know this process is twofold, so we have a framework for students as well. Right, students so often they want to take charge. They have these great ideas. It's really encouraging to hear about the work Sohan's doing at West Virginia University to mobilize students and to move things forward. So the STEP framework encourages students to step up to lead conversations on campus. And it really highlights the fact that the most powerful changes on campus start with students. So it's student-led programming and policy change. So students are encouraged to promote mental health awareness and education with a focus on story sharing and peer connection, knowing that the power of stories is so incredible among our students, both the good and the bad. Students are talking about it on our campuses, and that could be an experience using the counseling center or seeking support. It also encourages students to take part in training and technical assistance, right? So many times our students are idealistic and incredibly hopeful about the changes they can make, but sometimes they don't necessarily have the skills necessary to appropriately advocate for what they need. So this encourages students to take part in trainings, to engage with national level campaigns, to learn more about student-informed program planning, and to develop support through faculty, staff, and their Active Minds advisor. The next part is engaging diverse leadership and collaborative relationships. So students recognize they can't do this alone. And we encourage them to discover and engage key cultural and community-based stakeholders to involve partners and increase the amount of diverse perspectives in the work they're doing. And then the last part of it is assessing progress and measuring results. So we want our students to see that the work that they're doing is come to fruition. We want them to follow national trends in higher ed mental health, so they can continue to move this work forward. And then we want them to actually measure the impact on their campus, researching their campus climate, and continuing to respond for what finds best. We find that both students, faculty, and staff who work through these frameworks typically have more engaged students in the process. The programs that they put forth are a lot stronger because they're student-led and student-driven, and our students are invested in the work. If they're the predominant stakeholder for what we're doing, it makes sense to incorporate them. So those are a little bit about our frameworks. You can find them both on our website. I'm also happy to touch base with anyone. Towards the end of this, I'll put my information in the chat. But hopefully this provides a nice overview of the frameworks Active Minds uses to mobilize and engage students.
Well, thank you, Amy. I can't say that I remembered all of the letters that the acronyms stand for, but if you have a link to the Active Minds website that you can put in the chat where people can go and pull that information for sharing with others, that would be great. And putting your own information in the chat too. You said something that really struck me, and that is that the most powerful changes start with students. And, you know, just from talking to our panelists in preparation for the panel, I know that they also have seen that and believe that. And so I want to just kind of pose the next question to either Marissa or Soen. How have you seen these types of partnerships, like Amy was talking about, between the clubs and then the student offices on campus play out on your campus?
Am I unmuted? Okay, this is my first or second time doing this, so I'm just making sure get used to it. Anyways, for the partnership, anything that like I've specifically done, I've worked with the Career Center, the Office of Student Wellness, and it's mostly just like at a first-time thing. When I worked on the mental health statements, I was kind of like nervous, but I felt comfortable going to them, and they made me feel more empowered to do more. But when I worked with them, I saw more student leaders get interested in doing the same exact thing. So now a lot more students are getting more involved with the Career Center and Office of Student Wellness to do more. That's all I got.
So I'd like to add, you said that students are kind of the driving force of students, and really the only thing that I can say about that is that we are students, and we're really the only people that understand what our peers are going through. And, you know, even like our parents and our professors, obviously our professors went to college, they got higher education, so they have in some ways been in our shoes, but nobody knows what we're going through like the people who are going through it at the same time. And just like with COVID, that was something that just kind of came out of nowhere and threw a wrench in everybody's plans. And that's something that our professors and our parents and, you know, our adult peers who have been through college had never experienced before. So we were it. We were the only people to have ever experienced that, and the only people who could have possibly gotten that and understood what it feels like to be in the situation and feel completely alone is the people who are right next to us. So when things were happening with COVID and we started this midday meditation and we started kind of a little bit more of an outreach with the Lead Center and also with Active Minds and Falcons with Pride, it was everybody's first instinct, like Chi Alpha, our Christian program, and also our student government, to say, hey, we support you and we want to help. So when you said students help students and friends are, you know, the first people that we turn to, that's my reason why. So
To add on to that, Marissa, this past year has been one like any other. We had a global pandemic. Our nation was more politically divided than ever. There were so many social justice issues, and just that alone put so many mental health issues on students. And then on top of that, you have class. So at the end of the day, only we know what's really going on. Not to discredit anyone or what anyone's been through, but that's exactly why students are the driving force, because we truly understand them.
That's so true. And you all kind of got into the next question that I was going to ask you here, but I want to open it up and also give Amy an opportunity to respond. It's been a difficult year and a half for students. So I'm curious what impacts you have seen on student mental health that were either related to COVID or virtual learning or some of the other things going on. So Amy, do you want to share kind of a little bit from your perspective?
Absolutely. So we at Active Minds did 2 surveys during the course of the pandemic. One at the beginning last April, and then one in September, just assessing student needs and student mental health. And like any other national survey about student mental health during the course of the pandemic, we found that students were struggling, that mental health concerns were increasing, And students were looking for coping strategies. They were struggling with loneliness and isolation. And then when we think about students' basic needs, many students struggled with basic need insecurity, with questions about their financial security, housing security, and food security. That being said, it feels like that is very redundant in this space because most people struggled with their mental health at some point during the pandemic. One thing that we found really reassuring about the students that we surveyed there were actually two pieces. One is students recognized the need to help others. So our students identified that even though they're struggling with their mental health, they wanted to help their peers and they wanted to be a resource. So there's this altruistic feeling for students that, you know what, I'm not in the best place, but also my peers and my friends might not be in that either. So what can I do to help them? And that's where we really saw students step up, transitioning connection virtually. So many of our Active Minds chapters, and Marissa might be able to speak to this more, tried to do things to engage with their peers in the virtual learning environment. So whether it was a virtual game night or partnering up and having one partner each week that they would FaceTime with or connect with someone new, just really integrating many of these strategies in order to help them connect and to support their peers' mental health. The other piece that we found to be hopeful about is students remained optimistic and hopeful about their academic and job prospects following the pandemic. So rather than moving into this space of being incredibly pessimistic about the future, students still were hopeful that their academics would be on track, that they would be able to find a job. And kind of the nature of a global pandemic is most people went through it together. So it was reassuring that students hadn't turned or shied away from academics. Now, we do know that plenty of students did drop out during the course of the pandemic for multiple reasons. But from the students we talked to, many of them being Active Mind students, they were optimistic. So I'd love to turn it over to Sohan or Marissa to talk a little bit more about what they saw firsthand.
So I can start off. So I would like to point out, so that you said, you know, a lot of students stayed optimistic, and I did my best. It was really difficult. It was a really strange shift. It was hard for me to attend class as it was, getting up and, you know, getting ready and being there at 9 a.m. or even, you know, our later classes. And knowing that all I had to do was roll over and pull out my laptop and get ready for, you know, a session, it made me slack a little bit and grades slipped. And I know that I wasn't the only one. My roommate and I had a lot of long talks about how it was harder than it looked. And when things might have seemed like they were the easiest in our, you know, our higher education, they were kind of the hard. You're not getting that hands-on learning, especially like I'm in a tech program, and a lot of the hardware stuff that we were working on, how am I supposed to learn that? How am I supposed to remember those things? And it was hard. And I did my best to stay optimistic. There were a lot of times that I wanted to change my major or do something, and I thought, you know, if this is what I'm interested in, there's nothing else that's going to be any different. My roommate was a biology major, and it was incredibly difficult for them to be in lab because they had to be split up by people. So then they had to, you know, have late labs in times that they weren't scheduled for. And often she would be busy and they would say, okay, well, this is really our only time to get in, so we're going to need you guys. And that is incredibly difficult for somebody who already has a job and classes to tend to, and also your clubs and your organizations and also your peers and your personal life. So I felt for her, and, you know, in a way, you know, I felt for myself. And not only that, but I also started at the Lead Center right when COVID first hit, right when we first came back. I actually got the job before everything, and I was supposed to be starting at the next semester. And then I wasn't even sure by the time that we came back that I was even going to still have it. And the first day I thought, do I show up with a mask? Do I show up? How do I dress? I have no idea. I've not spoken to anybody. And it was really difficult. And if it weren't for Brittany Kuchta being the most amazing supervisor and understanding that this is new for all of us, I don't know that I would have been there and that I could have done it so easily. But being in that position, it's been not easy, but it's been easier to help our peers and other students and even professors who are going through the same kind of thing, just wondering, what's gonna be thrown at us today. Everything was different, and every day something was new. There was something else going on, and it's not just, if it wasn't COVID, it was, racial injustice and political divide, as Sohn was saying. So it's been a rough year and a half, absolutely. But as I said before, going through this has made us more equipped to help other people who are going through the same thing.
And just to talk on that a little bit, because of we also have the social aspect to our lives. I know the second semester of this past year, I was fully online, so a lot of the time I was just at home, and it was just work, eat, work, sleep, and that's kind of my life. And it got really bad for me, and I know I'm not the only person it was like that for. A lot of students, it was very bad, because without that socialization in your life, it feels like the same thing every day, and people just start to struggle. And if it wasn't the pandemic, there was a lot of other things going on in the world, like Marissa said.
I think you all bring up really good points, and it makes me kind of think about the work that you have led on your campuses. And, our audience today is mostly educators and people who work in support roles for high school and college students. And so, coming from your experience with your peers, what do you want educators and those working in supportive counseling positions to know when it comes to talking about mental health with you and your peers?
This is more towards educators than people directly working towards mental health. I think students just want you to talk about it more and not make it as taboo. I know throughout the year we kind of just like act, or I know I have a lot of professors that kind of just acted like all they do is just teach and that's it. And there's students clearly struggling, not showing up, doing bad in classes, and their professors aren't even reaching out. I know I had a professor that actually did reach out to me because March just became so much for me. And she reached out to me, she made sure I was okay and stuff like that. But no matter like what grade you're in or what grade you're teaching, what level you're teaching, I think it is important to talk about as a group, maybe individual to individual. Just don't like try to avoid it, because these are real problems that even kids are facing nowadays. You would think they wouldn't, but teenagers, even younger, can be facing problems like this. And at the end of the day, I think it's just important, not even just as an educator, but as a human being, to talk about it.
Yeah, and on top of what Sohn said, I agree, and I think that reaching out is important, and also just understanding that, as I said before, while you may understand what the stress of college may have been like, we are the only people who have experienced this, and other than our peers, we don't have anybody to go to, and especially people who don't have those peer groups and the organizations such as Active Minds, they don't really have anybody to talk to. And I know there are people who are stuck, and in their hometowns and in Ohio and in Maryland that couldn't come back here because of regulations and stuff. And I can't imagine what that must have been like to be stuck, and maybe you're with your family and maybe with your friends there, that there's an entire university that you're missing out on, and all of the organizations that you might have been a part of, that's all been ripped from you. And I just, to have been in that position, I don't even know how I would have reacted. And I know we tutored a lot of them, and I remember actually one of my peers tutoring someone who, again, he was in Maryland and he had just gotten COVID, and he just couldn't even find the time to focus. And it was virtual, and he, didn't have any internet, and, on top of family and dogs coming in and interrupting and stuff like that. And that's difficult because not only, is it just you working on your class, but you're realizing, hey, I'm not doing so great and I need help. I need to figure this out. And for him already trying to seek help and realizing, okay, this is the first step, but then that even being kind of bombarded, that's something that, again, this is kind of the first generation to have ever had to deal with this. And as long as educators understand that and let their students know that they do understand that, and that they're not just saying, but realize that this is difficult. And we can go to our parents and we can go to other adults that we think may be able to help us, but people who are our age don't know any better than we do, really, other than just to say, hey, we get it and we're here. So I think that's important. And as Sohan said, I also had a professor reach out to me kind of closer to finals and just say, hey, I haven't seen you as much, and I know that your performance isn't what it has been throughout the semester, and I was just wondering if you needed any help, if you needed any assistance. And we just kind of talked, and I just told him, things have been bad, and the last couple of months, it's been really tough trying to get everything together. And, I had some classes that were in person and some that weren't, and it was hard trying to figure out, when do I go, when do I not? And when I'm not going, how do I study? And everything all mixed up. And it was, honestly, I was lucky to have made it to lunch on time on any given day. So I just kind of let him know that. And, he was there for me, and he was a tremendous support in those last few months. So definitely just understand that this is tough. So if there's any advice that I can give, that's it.
Yeah.
Can I jump in here too,
Yes.
Carolyn? So while I'm not a student, I do talk to lots of staff about this, right? And I think two things that are really telling from their stories, Sohan and Marissa's stories, are how memorable it was and how much it meant to them when a faculty member reached out to them in a time when they were struggling. But on the flip side, I understand how difficult and scary that can be as a faculty member and as an administrator, right? You don't know what a student's going to say. You might not feel like you're equipped or have the tools to appropriately respond. And one of Active Minds' programs is VAR. It stands for Validate, Appreciate, and Refer. And the idea behind it is that anyone can be there to help. And we find it to be really helpful for peers, but also for faculty and staff in their interactions with students. So reaching out to them, asking what's going on, and knowing that what they say, you can validate what they're feeling, right? And without oversharing or your own experience. And then you can appreciate them sharing. So it might sound like, thank you for talking to me about this. For a lot of our students, they just need a place where they feel safe and supported to share that. And then you don't have to be the final stop. You don't have to help them solve their problem. You can refer them to an appropriate resource. So I encourage every faculty, staff, and administrator to determine where on your campus and in your community are those appropriate places for referrals. The whole process doesn't take long. I used it as a faculty member, but it really does sound like that's what Sohan and Marissa experienced during the course of the pandemic. Someone who was there to listen to them, to validate what they were experiencing, to appreciate it, and then if they needed it prior to a student being in crisis, to connect them to the supports that they needed. Sorry for jumping in, Carolyn, but it felt like an appropriate time.
That's great, Amy. Thank you for doing so. And, I want to kind of shift. We have about 10 minutes left for questions. And so I want to invite anyone that has any questions for the panelists. Please feel free to send them through the chat or through the Q&A function, and we can direct those questions to the students. But I want to think again about our audience that's here today. And we've kind of talked about some ways that they can support students who are struggling with mental health. And like Soen said, just being human. So it's not necessarily in your role as an instructor or a teacher or a staff member, but just being human. And so I want to shift and ask the panelists a little bit about what can teachers, faculty, staff do to empower students to start raising awareness and to do the type of advocacy work you all have done, because you all have gone kind of above and beyond started with talking about your own mental health to your peers and to other people, but now you've kind of stepped into the shoes of leaders that are helping others to do that. So is there anything that these faculty and staff attending today can do to help students take on that kind of empowering role like you all have taken on?
I would say ago today, I wouldn't think I'd be speaking here all of you guys today about mental health. I didn't even think I would do anything about mental health this past year. But working with people like Tian Hawkins and Nathan Harlan from West Virginia, and a couple other administrators like the Dean of Students, Corey Ferris, it made me feel more empowered, and not just to talk about mental health, but as a leader. And just like giving that advice, being there for students, that's really what sets it apart and what makes them feel more empowered and more driven to do something. That they have that support group and that you're the core person that they will go to.
I really don't think that realizes for students, it doesn't take much more than just a conversation with another student to really make an impact. And, you know, we sit like at the tutoring center, we sat and just talked about how things were going and how difficult classes were, and, you know, just our personal lives. And it, you know, it's nothing crazy deep. We didn't have to overshare or anything like that. Just talking and saying, you know, I get it. And I hate that you're feeling the way that you're feeling, and just having that conversation. And actually, I recently started a club with a couple of friends for technology, and we didn't even, for the last few weeks, we didn't even talk about technology because we couldn't even start the club till next semester, but we still wanted to meet because I think it was every Wednesday after work, we would just sit and just talk about classes and how different things have been. And I think that in itself made a huge impact on all of us. And that's all it takes. It doesn't take much more. So for faculty and, you know, administrators and educators, really just let students know that that's all it takes. You don't have to be this crazy leader, and you don't have to have all this knowledge. You just have to say, hey, I'm here, and, you know, I want to talk anytime. And I think that's the most important thing, is that me going into my sophomore year, not having any idea how to help anybody, I thought, oh my gosh, I can never talk in front of people. I can never, you know, lead outreach programs and stuff like that. But once I started doing this and speaking with Amy Snively and Brittany and all this, I realized I don't have to even do that. I don't have to go out and speak in front of crazy crowds or, you know, be this leader. I just have to, I'm here. I've been through this too. And although I might not know exactly how you're feeling, because all of our situations are different, I'm still ready to talk. And I think, you know, that's just important, because I've gotten a lot of text messages and even emails from people who I've never spoken to before, just saying, hey, are you free to just chat anytime? Or, you know, do you have any resources for me about, you know, certain things? And I was able to either reach out to Amy or reach out to Brittany Kuchta and just say, hey, these are the resources. If not, I can help you. If you need anything that I can help you with, or if you just ever want to talk, I'm here. And it's not much more difficult than that. And I think that that's the most important thing, is that students see it as some kind of like generational approach, that you have to just be this leader and stand up in front. It's like you're standing on a mountain and you're on this pedestal and you're acting like you're better than everybody. That's the most important thing, that they just you're an equal to everyone else, and they need to understand that.
So we are coming close to time, but we have a question that came in for the panel. And the question is, I work primarily with students who are getting ready to transition from high school to higher ed. What advice do you have either of those students struggling with mental health issues during this transition, or for folks like myself who are helping them through this major transition in their life? How can I help facilitate that relationship development handoff from one support network to a new one?
So I'm happy to start this, Jennifer. Following up the last question for the students, they really talked about things that you can do on an individual level to support students. Some things I would encourage institutions do, and I think Sohan's done this really well, are look at your policies and procedures surrounding how you're supporting student mental health. How do you have wellness integrated into your strategic plan? And to Jason's question, when we think about supporting students during that time of transition, what are the warm handoffs that we have? What systems and supports do we have for students? So if a student's in recovery and they're transitioning from high school into college, right, a really difficult time, lots of changes, lots of potential for relapse, right? Do we have systems that help us identify that a student is incoming, who's in recovery? What supports do they have? Do they have peer mentors? Are they connected to the counseling center? How are we identifying those students? And then also from our end as administrators, how are we communicating back to our students that these things are available to them? For students with mental health diagnoses, are they connected with our offices supporting students with disabilities to make sure they have appropriate accommodations, right? So there's this individual level approach, which I think means the most to our students, offering this grace and kindness around the struggles that they're going for, having these conversations. But really, as administrators, moving forward to improve the mental health climate on our campus, we need to start asking ourselves, what are the systems, the policies, the procedures we have in place? Are they equitable? Are they student-centered, right? Are we avoiding doing things that are stigmatizing students within certain groups? And are they sustainable? Are we providing appropriate funding? Do we have counselors that represent our student body? And so I hope that gets some of your question, Jason, but I know we're reaching time.
Yes, thank you so much, Amy. And as we kind of wrap up this session so that you can get on to your next session, I want to say a huge thanks to each of our panelists today. This has been such an excellent panel, and the work that is represented by these students on their institutions is incredible, and they're just getting started. And so I want to just wish the very best to you all as students, and hope that you'll keep in touch and keep us updated on how things go this next academic year, and just wish you the very best in your future endeavors. Another big thanks to Amy with Active Minds for joining our panel today. And I'll turn it back over to you, Jennifer. Jennifer, you're on mute.
I am. Thank you all for this wonderful conversation, and thank you everyone for joining us for this session. Feel free to visit the expo before joining your next session, and you can always share insights from the conference and social media using our hashtag StudentSuccessWV. Enjoy the rest of your day.